The treatment of any patient during a pandemic poses a number of hurdles one never thought about before. But what happens when an elderly and a medically compromised patient with a space infection reports to the OPD during a pandemic? Well, that triad happens to be the core for this poster. An 80-year-old female with a chief complaint of pain and swelling on the left side of the face for the past 1 month reported to the OPD. Her CT revealed a submesenteric space infection extending into the submandibular and the submental space, most likely to have spread from the left molars, which were grossly disrupted. The patient was a known case of chronic kidney disease, which was stage 5, and was undergoing regular scheduled hemodialysis. The anesthetist deemed the patient high risk for general anesthetic procedure, and so incision and drainage under LA was planned and carried out with intraoperative monitoring of vitals. Incisions were placed over the buccal vestibule intraorally and near the angle of the mandible extraorally, and about 50 ml of pus was drained and an extraoral corrugated rubber drain was placed. Extraction of the left molars were done under LA, and an empirical antibiotic therapy of amoxicillin and clavulanic acid was prescribed. The patient's pus aspirate was sent for antibiotic sensitivity and pus culture. So the next few days, the patient had to report daily for drainage and a sterile dressing was placed. On day 4, the patient's culture report came back positive for gram-negative bacilli, Klebsiella pneumoniae, and after obtaining nephrology clearance, injection cephalosporin with sulbactam 3 grams IV was given as a loading dose, followed by 1.5 grams IV BD for 7 days. On day 7, though the patient's swelling decreased, still persisted, and so an ultrasound was ordered which revealed pus collection in the parotid space and drainage was done accordingly. The next few days between 7 and 13, daily drainage was done and a sterile dressing was placed, and this time a second culture report was ordered. The patient failed to report for treatment between days 14 to 19 and reported back on day 20 with a mild swelling and pus discharge, and so a second CT was ordered, which revealed submandibular abscess with multiple air pockets. The patient's culture report came back and that revealed sensitivity to linezolid, and after obtaining nephrology clearance, it was administered orally. After 1 week, on day 28, the patient was finally asymptomatic without any pus discharge. So the most noteworthy point of this case is that the aggressive management, both surgically and pharmacologically, was contraindicated owing to the patient's medical status, and a more gradual phased treatment protocol was followed, which did not disrupt her treatment or her medical condition. Thank you.